yeah, so asymptomatic cases are basically individuals who don't develop any symptoms. So like the symptoms that I mentioned earlier, like fever, joint pain, breathing difficulty. So you don't show any of that, but then you are COVID-19 positive, and then that is asymptomatic cases are much more dangerous in the sense that it can spread to other people unknowingly. So you wouldn't know that you're COVID-19 positive, but then you have end up spreading to your loved ones. So that isn't what most people would want, right? Yeah.
Yeah.
So then there's a time lapse of people who get COVID and how the symptoms manifest over time. So usually from day 1 to day 22, some people would either live or some people would either die, right? So to cut it short, by day 5, COVID-19 positive patients with pre-existing conditions, they will really have trouble breathing by day 7 and will most likely end up in the hospital. So during this time, the mild cases, people with mild cases, they will usually clear up.
Yeah.
They will just leave the hospital and they'll be fine. But then again, those with moderate to critical cases, they will develop, one of the problems they will develop is pneumonia, right? So pneumonia happens when you have trouble breathing. So this is really indicative of what happened to COVID-19 positive patients. And then those individuals who get pneumonia, it can either be non-life threatening, or in contrast, it could be very severe to other patients. So those with critical cases, they could develop something called ARDS, whereby there's a fluid buildup in your lungs. So when there's fluid buildup in your lungs, your intake of oxygen is very low. So that's when you need to be in the ICU, for them, because your life is on the line by the time. So then if the patient survives that phase, that very critical phase, they would probably succumb to long-term permanent lung damage. So when you check the X-ray, you can see that those who've gone through very serious cases of COVID-19, if they survive, in their X-ray they will show like in their lungs they will have like lesions, like sort of like holes in their lungs. So that's why people say stay at home, don't go out, because once you contracted the virus, the long-term damages really makes it not really worth it, to go out that much. So there are studies that show that people who contract COVID-19, they would die usually by 14 to 19 days, right? And those who recover would take probably 2.5 weeks to recover. But then again, those who recovered, they won't show any symptoms, but they could possibly still spread. So yeah. So Pooja, so after I've been talking about the COVID-19 symptoms and tests, right? I know that a lot of people, the government and a lot of people on social media have been saying that we have to take precautions, right, to keep ourselves and our family safe. So can you explain to us how should we try to protect ourselves and our loved ones?
Okay. So thank you, Ryan. So you guys know that to keep yourself and others safe from COVID-19, you need to maintain at least a 1 meter distance between yourself and others, because this reduces your risk of infection when they cough, sneeze, or speak. So when you guys are indoors, remember to keep a greater distance between yourself and others. The further away the distance, the better. And always remember that you should wear a mask when you're around other people. So for your mask to be as effective as possible, it's important that you know the right way to use, store, clean, and dispose the mask.
Oh, so speaking of knowing the right way to use the mask, do you know like how the basic of how to wear a mask?
Okay, so remember to clean your hands before you put on your mask. This is the most important one, and as well as before and after you take it off and after you touch it at any time. So make sure that the mask you're wearing covers your nose, mouth, and chin. So when you take off a mask, store it in a clean plastic bag, and every day, either wash it if it's a fabric mask or dispose it in a trash bin if it's a medical mask. So most importantly, go use masks with valves.
What's valve?
Rayang.
Wait. Oh boy. Now
Yeah.
what does valve mean?
Hurry.
Yeah, so yeah. So valves means a device for controlling the passage of air. Keeping your environment safe is just as important as keeping yourself and your beloved ones safe. Avoid spaces that are close, crowded, or involve close contact. The risk of getting COVID-19 are higher in crowded and inadequately ventilated spaces where people spend long periods of time together in close proximity. These environments are where the appears to spread more efficiently by respiratory droplets or aerosols. When you want to meet people, meet them outside. Remember, guys, outdoor gatherings are safer than indoor ones, particularly if the indoor spaces are small and there is no outdoor air coming in. So avoid crowded or indoor settings, but if you guys cannot, then try opening a window because this increases the amount of natural ventilation when indoors. And again, always remember that you should wear a mask. So, do you guys know that having a good hygiene is a part of keeping yourself and others safe from COVID-19? So, to
Yeah.
eliminate the germs and viruses that may be on your hands, regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, nose, and mouth. So, do you guys know why it's important to avoid touching your eyes, nose, and mouth?
Because our hands are contaminated.
Yeah.
Yeah.
Okay. Okay. Hands touch many surfaces and can pick up viruses. Once your hands are contaminated, your hands can transfer the virus to your eyes, nose, and mouth. From there, the virus can enter your body and infect you. So cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately into a closed bin and wash your hands. If you guys follow good respiratory hygiene, you can protect the people around you from viruses which cause colds, flu, and COVID-19. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as door handles, faucets, and phone screens. Okay, so since Rain has talked about the symptoms of COVID-19, do you guys know what you should do when you don't feel well?
I know that we need to
Self-isolate.
go to clinic.
Self-isolate.
Okay,
Quarantine.
so okay,
Go
so
to the
you
hospital.
guys,
Alright, never
okay,
mind.
thank you, Rayang. Okay,
Alright.
so you guys should stay at home and self-isolate even if you have minor symptoms such as cough, headache, or mild fever. So you should stay at home and self-isolate until you recover. If you need advice, you should call your healthcare provider or hotline, have someone bring you supplies, and if you need to leave your house or have someone near you, you should wear a medical mask to avoid infecting others. If you have a fever, cough, and difficulty breathing, you need to seek medical attention as soon as possible. If you can, call by telephone first and follow the directions of your local health authority. And this is probably the most important one. Remember to keep up to date on the latest information from trusted sources such as WHO or your local and national health authorities. Your local and national health authorities and public health units are the best places to seek advice on what people in your area should be doing to protect themselves. So, we have discussed about the symptoms of COVID-19 and how everyone can take precaution to take care of themselves. But not everyone take it seriously. And it is our job to always remind each other. And maybe, Megina, would you like to explain how COVID-19 can affect everyone's daily life?
Okay, thank you so much, Pooja. Yes,
Okay.
it's true that COVID-19 can affect our daily life. It doesn't affect just a part or a slice of our daily life, but as a whole, because it has a domino effect. Once it affects a part, it will drag to other concern as well. So when COVID-19 hits us, pretty much some people would think that it is too overwhelming for them to accept, because what COVID-19 do, what pandemic do is that it do damages. It takes people's life, especially the oldster. It takes people's job. It slows down the global economy. And for your information, under a global economy, I would like to touch on this one sector, which is our education, because COVID-19 affects our education. So if you may not know, right, education plays an important role in the process of economic development. It is actually a key factor for a country to be on a competitive level with other country. So for instance, like in our education, we have higher education. In higher education, there is college students and university students. So these students, they are being trained, they learn to show their skills, right? So when there are more skills shown, there will be productive worker in the future. So education do promotes growth and development at the end. Without the education, the whole economy of a country can be stunted or undersized. And this is the possibilities of COVID-19 can do to us, to the students. It will affect the students. And as for today's discussion, I would like to emphasize in the students' context, because this discussion has not much been said in general. For university and economy, they actually depends on the students. They depends on our progress and the results, so that they can stay at a competitive level. It doesn't matter if they want to stay in an international level or just compete with university, like side by side, as long as they get best results from students. But to get the best results from the students, the well-being of students needs to be taken care of. So let's take a look. Let's like has a flashback before COVID-19. We, the university students, we actually have active interaction between our friends and the lecturer, if you guys realize, right?
Yeah.
So there
Yeah.
is no boundary in asking questions to the lecturers. We are free to do whatever we want in terms of learning. And if we forgot to ask, we can always email the lecturer. It's like we have a backup of everything.
Yeah. So now the
So
backup is like the
when the
main
teacher
thing.
teach, yeah. So when the teacher teach the students, students will stay focused in class because the teacher will generally watching us, and we, the students, will watch will watch the teachers and the whiteboard. So like the full concentration in class just comes out naturally, and that is just like the interaction between the lecture, not yet with friends. And when it comes with friends in university, we can always ask them questions, discuss, or make group this assignment together. So like everything is easy when there is physical and face-to-face interaction. And I would say that students can really enjoy themselves as a university student. Like they learn to become more responsible, because like they wake up early in the morning just to get to early classes, for example. And then like they just know what to do for as a student. And then like when there's exam, they learn how to become more responsible and ace their exam, because there is perfect support from the teachers and